I spend a lot of time listening to patients. I want to hear their story. I want to understand what's happening with them personally. I want to understand what social things that they're dealing with that may be a barrier for them. I want to know what their supports are, and I want to understand what their health goals are. My interest in healthcare started when I was a little girl. My mom, while she was preparing patients for x-rays, I would sometimes sit with the radiologist while they would read films as she was getting the patients prepared. So it was kind of ingrained in me. By the time I was 8, I said I wanted to be a doctor. I joined AbsoluteCare in 2018 to know that the support teams were there, that processes were in place to be able to make sure that our patients not only have the care that they get during the visit in the center, but that we are supporting them as they go home, as they're trying to carry out those care plans. It just felt fantastic because this is what I always wanted for my patients, but just didn't have a way to make it happen. Watching our team members come to a point where they really understand why we do what I like to call this extreme hand-holding medicine and seeing the outcomes of that. I just want folks to feel heard. I want them to feel like they matter. And so I hope that when team members are shadowing me or if they've talked to patients that have been cared for by me, that that is what has been imparted upon them. It's this team approach, this way to practice medicine that really is beyond medicine that has drawn me to AbsoluteCare and has really kept me here. We have to be patient, be dedicated, be willing to go back to the drawing board again and again to try and get to a particular goal. And that is really what it means to go beyond medicine.